Ah, y a pas de son.
Video will reach you, but I'm recording this greeting to you in this presentation a few days before your conference. I want to thank you very much on behalf of WHO for the invitation to address you at your conference and to share with you some of the insights that I, as a nursing and midwifery policy advisor, have observed with my colleagues as the real main issues for retaining and recruiting nurses in the WHO European region. So I hope you can see my slides. As I said, I'm speaking on behalf of WHO the WHO European region. This is one of 6 regions and regional offices that support headquarters. So most of you will know that our headquarters sit in Geneva, but the world is divided up in 6 different regions so that we can better serve those regions. And I'm speaking to you from Copenhagen, Denmark, where we have our regional office and where we support 53 countries. Including the European Union, but also moving as far east as the border of China, including countries like Russia, Kazakhstan, Kyrgyzstan, and we also serve the United Kingdom, Iceland, and Greenland. We have many time zones, therefore, 17 in fact, and 4 of our WHO official languages fall in our region, but also hundreds more languages in our region. But despite all of this diversity of countries and cultures and languages, there are a lot of common problems facing our member states. And here I would just like to draw your attention to the European Health Report that was launched a few months ago in December, and where we presented some of the most concerning issues of our time. Well, the first that I want to draw your attention to is that the population is aging, but in the European region, that population that aging of the population has surpassed a threshold. So this year, the percentage of population living 65 and older surpasses the number of people who are 15 and younger. Now, this in itself wouldn't be a major problem, obviously, if we had met the care needs of these people. But we are seeing considerably higher care needs with progressive unhealthy aging of our older population. The European Health Report showed that nearly 50% of older people with severe self-care difficulties cannot even get the help that they need. We also see that in the younger populations, the first 5-year milestones for children are not being reached, and some of those indicators are declining for children under 5. We're seeing that 76,000 children in our region alone die before their 5th birthday. And within our region, there's a 21-fold difference between member states, some of them doing very well, but some of them doing very poorly in managing child mortality. We're also seeing the increasing use of e-cigarettes, so major public health challenges amongst our adolescents. So that sort of addictive behavior is on the rise. And we're also seeing a mental health crisis with girls' mental well-being is generally worse than boys, but as we see, 1 in 4 women and girls are experiencing violence in their lifetime. And suicide, unfortunately, is 4 times higher in men than it is in women in our region. Some of you will also know that the resurgence of vaccine-preventable diseases is haunting us, and we have seen a very large rise in cases of measles and pertussis in our region. And unfortunately, in our region, we are not seeing the target coverage of 95% being reached in our region. So when it comes to diphtheria, tetanus, pertussis vaccine, we do have about 95% coverage, but in some countries, that coverage is as low as 68%. And we're also seeing measles containing vaccine, the second dose not being taken. So we are not meeting the 95% coverage in our region, nor are we meeting the 95% target coverage of pneumococcal conjugate vaccine final doses. Some of you will also be concerned about the antimicrobial resistance. Some of you are managing antibiotics and will know how important it is to manage those very carefully, because we are starting to see such a high resistance to antibiotics that actually one death is occurring every 20 seconds. Some other risk factors with our region has one of the highest alcohol intakes of 8.8 liters, and 25.3% of people in the region are tobacco users. That contributes to a death rate that is quite high in our region and shows people dying well before 70 years old from at least 4 of the major non-communicable diseases that tobacco and alcohol contribute to. Not to mention obesity is very high and affects 25% of adults. So it's not so much, though, that these rates are concerning, but another aspect that concerns us as the WHO Europe region is that we actually know what to do in these cases, and we're not achieving that. That's called the quality of care gap. It is estimated that actually from the 8.6 million deaths that occurred from amenable healthcare conditions in 2016, and that number is estimated to rise after COVID, around 60% are due to poor quality of care. So that gap in quality of care, the gap between what we know what we can do and what we actually are able to do, contributes to from 5.7 to 8.4 million deaths annually. This means care that is missed, so not given at all, delayed, duplicated, and contradicting. So, and that death toll actually is higher than the total of HIV, TB, and malaria deaths, related deaths combined. For me, as nursing and midwifery policy advisor, this points to an important challenge for us as nurses. And for us as nurses, my appeal to you as a policy advisor is to really value and appreciate the role that you have in improving the access to quality and timeliness of care. This is within our scope, and this is that special value added that we as nurses offer to the healthcare system. We personalize care. We can help develop care plans, looking at the entire patient and their needs, their family circumstances. We can bridge that clinical and social care knowledge, incorporating some of the considerations of social determinants of health. We can expand care. We can identify moments where we see, you know what, this patient really needs someone else involved to help them. But also, we can increase opportunities for prevention, for teaching our patients to avoid deterioration in their health, or to be properly able to manage the current conditions that they're having so that they don't have to return to the emergency room, but that they feel empowered as patients and can live as close to as possible to their home and communities. We can connect care. We are really important as nurses to identify which are the different health providers that are involved in this patient's care, and making sure that all those health professionals are connected, are getting the same information, and really steer the multidisciplinary teams that we need to have around our patients. And finally, nursing is fundamental to securing care, to monitoring patients, to identify and communicate gaps that are maybe missed for our patients with our medical, social, and mental health knowledge. We can really support not only the patients, but the entire system, other nursing assistants or other health providers, make sure that the patient is getting what they need when they need it. So, what do we see in the European region? We see actually that there's an increase by 8% of the density of nurses in the European region. It has risen, the density. We have seen a slight increase in the production of nurses, so 2%, with nurses graduating per 100,000 population rising by 2%. We also see that nurses are primarily women. And in our workforce, that is 89% across the region. In some countries, that's as high as 99%. And in some countries, the lowest countries or the lowest percentage that we see is in Luxembourg. So somewhere between around 70%. So that means that there are a lot of women in our workforce, obviously, and that if we do not have gender equal societies and we don't have policies that support women in work, this will affect our workforce. It will affect the decisions we make around our families, around our children, around our older family members, and the career decisions that we make. So there is a bit of a gender equality crisis as well. Some of those things that impact our workforce, the policies that perhaps do not promote us to stay in work as long as possible or to pursue our career goals, has led to a gender equality crisis. Now, here I have the number 75%. That's of the entire healthcare workforce. So this is not an equality crisis that affects just the nursing workforce, but it affects our medical workforce, our physiotherapist workforce, our dentistry workforce as well. And what we see resulting in the health and care workforce, and this year I'll be working very much on looking at how it affects nursing in particular, but overall or across the health and care workforce, we see that despite our high prevalence as women in this workforce, only 30% are reaching leadership positions. And there is a 24% pay gap between women and men in the health sector. That's double other sectors. And that means that given a woman and a man with the same education, the same opportunities, you will see different pay levels and different payments made between men and women for some unexplainable factors, which we call gender inequality factors. We also see that whilst nurses are generally relatively younger than doctors, we see that they are nevertheless, 21% of our countries have nurses over the age of 55 years of age. So in 21 countries, more than 20% of their nurses are over the age of 55. So if we're only producing those 2% of nurses and we have 20% reaching the age of retirement, we're going to have to do something about the recruitment into this profession. And here we have a map or a graph that really shows that some countries are really struggling with that. We have Israel in our region, Iceland, Bulgaria, Lithuania, and Latvia having some of the highest percentages of nurses over 55 years of age. So why are there shortages of health workers? I've already mentioned the aging factor of our workforce. Unfortunately, we also saw health worker deaths during the pandemic. We tried to measure that number. The monitoring was not very good during the pandemic, but we found that 115,000 health workers did die of COVID, and we believe that that is a very big underestimation. 50,000 alone died in the European region. And again, we believe that this is an underestimation. We also have a lot of nurses migrating after COVID. So what we expected to decrease after COVID has actually increased. There's been an increase by 36% of nurses COVID. We've seen an increased number of health workers seeking part-time work. So that's reducing their hours and reducing their availability for our system, and a lot of resignation. So people leaving the sector well before their time. We believe this is because of sheer burnout. And I think speaking to a group of nurses, I probably am not surprising you with the sorts of statistics that we found, that up to 52% of our workforce is burnt out, that this is highest among nurses in some countries. It's been estimated is 70% among nurses, and the absences are increasing by 62%. So sick leave, issues related to anxiety and depression. And up to 9 out of 10 nurses declared an intention to quit their jobs. So we have not only seen a resignation, but we are worried that there are a lot of people still planning to leave the. We also see a lot of competition from other sectors. Other sectors are attracting young people a lot easier than nursing. So here's an example of the IT sector. So we know that for 15-year-olds, they are much more willing to join the IT sector than thinking about becoming a nurses or joining the health sector. We've also seen a reduction from 2.8 to 2.3% in the proportion of 15-year-old students who actually want to become a nurse by 30 years of age. So on the one side, we have, the demand of services, which I explained, and the low quality of care of services, requiring a rapid response and an increased response from our health workforce. And on the other hand, to the left of your screen, we have a real shortage, all sorts of factors causing attrition from the workforce, and therefore, despite having more health workers than we've ever had in the WHO European region, a higher density of nurses, a higher density of doctors, we experience a net shortage. We're also seeing people turn to the streets, and this study was very concerning to us, where we saw that 24% increase in the total health worker protest had occurred between 2018 and 2022. So at the WHO European region, we're taking this very seriously. We've been working very closely with ministers of health. We've been doing this through the pandemic, but especially as we were starting to emerge from the pandemic in 2022, we gathered ministers of health. The Minister of Health of Romania called a meeting of ministers of health in Bucharest to sign the Bucharest Declaration and a commitment to improving our response to health and care workers. And the following year, all of those 53 countries in our European region motioned for a resolution that would put forward a framework for action on what we want to do to improve the retention and recruitment of our workforce and take care for them. At the center is the retention and recruitment. And please note that we are starting with retention. It's important to look after those people that we already have in the workforce, and then only can we really be more ambitious about recruiting young people into the workforce when they see that those people we have in the workforce are actually staying in the workforce. But we also need to start thinking much more creatively about optimizing the performance, better skill mix, better interactions with patients, promoting the use of digital technologies, and to really modernize education and training, continuing professional development opportunities for you as nurses, and building digital health competencies to build your supply and your competencies to deliver to our patients, but also that your work is more rewarding for you. On the outside of this framework is really a plea to all member states and a commitment by all member states to do more about planning, to look at the numbers that we presented them, and to really do better data collection on what is happening, what is the current state of their workforce on a more regular basis. And this means not only measuring their availability, but also measuring their mental health, their well-being, and to put our money where our mouth is. So to really put investments behind those critical areas that we need to retain and recruit our workforce. So I spoke to you about the importance of nursing in connecting care, in tailoring care, in personalizing and reaching out to our most vulnerable, but also expanding care, as we saw during COVID pandemic, where nurses really were essential to creating those opportunities for screening. And in the war in Ukraine, we're seeing nurses really part of the response in staying with our patients and staying at those clinics, maintaining access to those non-communicable disease treatments or rescuing our patients and providing emergency care when they're needed. And that is why we also have a very special focus at WHO European region and at WHO in general for nursing and midwifery. This started with Resolution 74.15 in 2020. We are going to meet this year in May, in a few weeks, to discuss this resolution and the global strategic directions for nursing and midwifery. The core functions or the core strategic areas for these global strategic directions are to increase the amount of nurse-led service delivery models, to support their jobs, to support their working conditions, to create leadership opportunities and career opportunities for our nurses, regardless if they are predominantly women, making it possible to be a woman in the workplace, to achieve what you want to do with your job, and also to modernize and support our pedagogues to provide more research and education that is fit for purpose, that is modern, and that is keeping up with the health policy needs of our ministries of health. So in the WHO European region, we're taking this one step forward. Thanks to the European Commission, we have received funds to support a nursing action. We have several countries participating in this, but the core pillars of this work are to retain nurses, to really support an analysis of what is happening with our nursing workforce, and to recruit nurses, to start supporting member states in providing the conditions that and the analysis that is needed to understand how to recruit better to this workforce. We have 19 countries participating. We're delighted, and we have countries joining us all the time. And these countries are from a range of realities. So we have countries where there are high numbers of nurses and doctors that are part of this nursing action, but we also have countries that have low numbers of nurses and doctors. And we're not doing this alone. We're doing this with governments. We're doing this with those national focal points in 19 countries. Those are government chief nurses or heads of human resources for health. We're doing this with the Commission and the DG Santé, but we're also doing it with associations, the European Forum for Nursing and Midwifery Associations, the European Nursing Student Association, the European Federation of Public Service Unions, and the European Federation of Nursing Associations, EFN. So we're doing it with them, with their knowledge base, and they are reaching out to members in their countries, their members and to the nurses in those member countries to really gather information and plan with us and these 19 countries the different strategies that need to be in place for retention and recruitment. I also want to call your attention to a massive survey that we have done. It is just closed. So unfortunately, you can no longer participate, but this is the largest survey ever in the European Union on the mental health and well-being of nurses and doctors. And we look forward to sharing with you the results of this survey in. So on this note, I hope that I know it's very difficult to be at the front line. I know it's very difficult to be at that managerial level where you're trying to improve the conditions and the circumstances for your nurses. But I really do hope that I've left you as we approach the International Nurses Day with some sort of hope that we as WHO are very strongly committed to our nursing workforce. I, as the Nursing and Midwifery Policy Advisor, take this as my prime mandate to support the conversations that we need to have for our nurses, so that not only is it an equitable profession, but that we can achieve equity in our broader society, better care for our patients, and ultimately resilience and recovery. Thank you very much.
Alors, j'invite Christophe Debout, vice-président du CEFIEC, pour une petite conclusion avant la pause. Merci Christophe.
Merci, bonjour à toutes et à tous. Donc tout d'abord, nous souhaitons remercier Margrieta pour cette intervention. Elle n'a pas pu être avec nous aujourd'hui puisqu'elle est mobilisée comme l'ensemble des équipes OMS, puisque c'est actuellement la réunion de l'Assemblée mondiale de la santé. En tout cas, dans son intervention, ça nous a permis de nous situer au regard des pays voisins sur des sujets clés qui intéressent nos systèmes de santé. On a vu qu'il y a de réelles préoccupations et que tout cela peut générer des axes de travail communs, du transfert de connaissances, du partage d'enseignements autour des projets qui sont lancés. Ça nous permet d'identifier aussi des leviers, même si dans ce domaine-là, le copier-coller fonctionne assez rarement, mais il y a bien une transposition des adaptations à réaliser. Et donc, bien sûr, dans le prolongement de cette intervention, parce que le temps passe très vite sur ces sujets, eh bien, on vous invitera à suivre, grâce à votre veille documentaire dans les semaines à venir, parce qu'il devrait y avoir un certain nombre d'évolutions dans ce domaine. Évolution, pourquoi ? Tout simplement parce que le jour de la Journée internationale des infirmières, le 12 mai, l'OMS et le Conseil international des infirmières ont publié un nouveau rapport sur l'état de la profession infirmière dans le monde. Donc le dernier daté de 2020, donc entre-temps il y a eu 5 ans et une pandémie, donc forcément les conclusions de ce rapport sont très très intéressants à regarder. Il est disponible sur le site de l'OMS. Et puis bien entendu, comme ça a été le cas et comme vous l'a présenté Margrieta à l'instant, les conclusions et les préconisations de ce rapport vont être présentées aux délégués de l'Assemblée mondiale de la santé, et donc on peut s'attendre à des évolutions, à des affinages de stratégie dans les mois à venir. Ces sujets vont bien sûr être au cœur des discussions lors du prochain congrès organisé par le Conseil international des infirmières, hein, le congrès mondial qui aura lieu à Helsinki au mois de juin prochain, et donc nous ne manquerons pas de vous tenir informés et de vous relayer ces informations internationales qui percutent directement également notre réalité nationale. Merci à vous. Bonne journée.